Good afternoon. I would like to call this meeting of the CEO Performance Evaluation to order. I would love to know if there are any conflicts of interest that anyone would like to disclose. None. Would anyone like to read our mission statement, Mr. Lester?
Sure.
Thank you.
Our mission statement is to improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice.
Amazing. Thank you. Do we have anyone who wishes to provide a public comment?
No one has signed up. We have no.
Okay. All right. Well, let's get to the fun stuff. This is the second meeting of this committee, and last committee we got the goals out for this year and the agreed upon bonus, and so now we are looking forward to next year to come up with some new CEO evaluation goals. And I am hopeful that. I'm assuming we all have maybe some topics or things we'd like to see and can kind of flesh that out. So I am more than happy to defer to the committee first to just provide ideas, and we can go from there. We have some guests, and so I'm not sure if you all would like a moment to say anything or maybe not. Just wanted to check first. Okay. Okay, thank you for being here. Thank you. Fearless board chairs here. All right, would you like to introduce yourself? You got to speak into the mic.
Affairs at Meharry Medical College. I'm also the designated institutional official who is over all of our residency training programs at Meharry Medical College.
Amazing. Very, very busy. Well, thank you for being here. Our fearless leader is here, our board chair, and we just went through kind of introductions, and now we're just going to get to looking forward to next year's goals. And if you have any topics or any ideas for language to include in there, we would love to hear it. So I will pass it to Christy, who looks like she is ready. So I would love to just go through what you're working on, any ideas.
Madam Chair, can I ask a question first, just to make sure I understand exactly what we're doing today and where we're going? My understanding is that we are setting the goals for this current fiscal year we're in, which will end in June, in which case in June we will then do the assessment.
Correct. With the goals.
But we're also going to look at future goals for the next fiscal year.
Correct.
Okay.
Correct.
Good.
Thank you. I might have said that wrong, but thank you for clearing that up. Yes. Okay.
I just wanted to state that just some concerns as I was thinking over the process and after last meeting, the true evaluation that we are being asked to set into motion today is actually the last, 9 months or so. Mm-hmm. And so the concern that I have, for the record, is that we are setting goals for someone who has a 3-month period to ultimately execute on these goals. And I think I just want to make sure that that's stated, because giving someone something when there's a very short time period to execute on that either feels like it's going to be it's not going to allow for a real growth and opportunity to be impactful, right? So I just think that's a concern. Obviously, we're here to address that. I'll care, but I also want to state, too, that I am committed to the process. I'm committed to as many meetings as this takes. So if that is more frequency to these meetings, I know we have a short time frame. I don't want to commit for everybody, but if that's a weekly, monthly, bi-weekly, whatever we need to do to get the right information, collaborate, and then come out with a document that is achievable and a good step forward, I want to make sure that you know that I'm committed to that process.
As I am. because I think that is only fair to Dr. Webb, fair to this board, and fair to the patients that we serve. We are behind, and I don't know, to your point, Madam Chair, that we can get into too much gradient on this current fiscal year, since we'd only be giving Dr. Webb 3 months. But I think it is absolutely a responsibility, in fact, a burden that we have, that we be very clear and very detailed from this point forward for the coming fiscal year, to ensure that we are not behind, A, and B, that we have specific goals, because the goals that have been written thus far are unbelievably vague. I mean, with all due respect to Dr. Webb, and this is not a reflection on him, it is a reflection on these, that basically all one has to do is show up to work. And that's not really in everybody's best interest, including Dr. Webb. So I agree with you, Christy. And if it takes more time for us to do this, I am certainly willing to participate.
Yes, we can definitely meet as frequently as needed, and I do think that that is something we should get on the calendar consistently, so we aren't waiting till the last minute or backdating. And I 100% agree about it not being fair to Dr. Webb to come up with something totally brand new and then say you have 3 months to execute, but also not providing enough support for him to be successful and grow and move the hospital forward. So I definitely think we are in alignment with that. Did you have anything you wanted to say?
No, I'll just add that we are behind, but this is the earliest we've ever been in front of this in the last at least 7 or 8 years. That's bad, and it's bad that we've been so behind all these other years. But it's also good that we're moving forward aggressively, and we got a good committee. I agree with you. I think it would be. I think it'd be unfair to bait and switch or change the game in the middle of the game with 1 quarter left, right? You don't want to change the expectation that was already laid out. But I do think if we want to add some meat to the 4 things that we want to look at, we certainly can add some meat to, it says growth, financial quality, customer service. If we wanted to add a little bit more meat to some of that, we certainly have the prerogative of what we will look at under those categories. I wouldn't change the category. But in terms of what we would look at under those categories, the other component about the evaluation that I think is going to be important, we've been looking at this in the terms of purpose of do you meet these and do you get the bonus? Mm-hmm. I think that's one component of it, but I also think another component of it is just in terms of a full evaluation outside of bonus. Like, am I making sense? Like, we looked at did you meet these things? And if you met these things, then how much of that qualifies for your bonus? That's not really an evaluation. So I'm saying that's a component of it, but I think we should go out above and beyond that, provide feedback and say, here are some other things that would be important to the success of the hospital. And again, I wouldn't attach those things to the performance bonus, because that would be, again, a bait and switch. But I do think it's something that, in terms of feedback, we should look at.
I agree with you. I think it's very important that we look at it in that regard, as you mentioned. But I would also say, I think maybe this could be helpful. I want to hand this out. I went to the American Hospital Association website, and they've got a CEO assessment evaluation, which I thought would be interesting to take a look at, not necessarily to copy specifically, but for some ideas. There are some things here that I think are a little bit more specific. And again, back, Frank, to your point, meeting expectations, frankly, is not good enough. It is, what are the stretch goals? What are the things that we need to do even better in each of these categories, and how do we evaluate them? I don't know that under the current circumstances we can say meets minimal or meets expectations or exceeds. We don't have anything to grip on to make that evaluation. And I think that's part of what we have to get a little deeper into. But I think it would be helpful to take a look at these if you think it's appropriate, because I think it can generate some ideas.
Definitely, and even looking to Chair Stevenson's point, even if you're keeping the same 4, I think those are 4 great metrics to evaluate, but just fleshing out, even just taking a quick glance at what you've provided, what are the bullet points? Are they specific enough outside of the doors are still open? I completely agree with that. And so I would imagine if we're sticking with that same kind of formula, those 4 topics, would we want to just go through growth and say, this is what we think growth would look like? This is how we've measured it in the past. These are 3 things we'd like to see in it. And the same for financial. This is what we're looking for, just to at least get some words and terminology and phrases out there before we start wordsmithing. Does that sound?
Okay. It does. I guess what I mentioned in the last meeting, has there been, when you compiled the last evaluation, can someone walk me quickly through how the current evaluation was set up and where that data was pulled from?
When you say the current evaluation,
The one that we just passed, we voted on this last time, that we discussed in our last meeting. How was that criteria set up?
so the previous committee designed that.
But just random 4 people? Did you use third-party data? Did you pull other CEO metrics and performance from Metro or other hospitals? Or how did you create it?
Okay, yeah, I'm not sure. I wasn't
No.
on that committee.
It wasn't done that way. It was, these are the goals and objectives. Does he do the 1 through 5, meet expectations, exceed? But that was passed down from the previous committee for us to evaluate, but we did not dive as deep and take into account all of the other CEO evaluations and things of that nature. I think it's just been just a process of what was done before you. And I think now we just know we want to dive a little deeper. We have big plans. We want to see those through, but also making sure we're doing the full evaluation. So.
Ask a question. I don't know if I have the floor, Madam Chair.
Oh, yes, you can ask a question.
Okay.
Push the button.
My question is, having come from, I've been here in Nashville for 20 months. I came from a big health center, Safety Net Hospital, Grady Hospital, and Hospital Authority Board at a Piedmont Hospital in Atlanta. So we had set metrics, is what both Ms. Smith is saying and also Mr. Lesser is saying. It was very strict guidelines. And also that's one of the things I just wanted to do. It was extensive, probably close to what you want. And then when you're dealing with an academic health center, we held Mr. Hopper at Grady for residency standards. So, we had to do, now granted it's a 1,000-bed hospital and we got residents from both Emory and from Morehouse School of Medicine, but there were a set of standards. So I think I'm happy to hear that, because I do have some things that I'm used to from previous experience that you want to do if you're going to be also a training facility. There's just some minimum guidelines that you have to fulfill as well. So I think that both of your comments were very well taken. I just want to say thank you.
You're welcome. And I'd mentioned this before, is, being a collaborator by nature, I feel like it's great to see what are other Metro CEOs doing, what are other hospital organizations doing. I mean, if there's an opportunity as we kind of start this mission together, if there's opportunities to see that evaluation, some of these are public record, and some of these might be able to be obtained through friends and family network, if you will. So I actually obtained the CEO evaluation, performance indicators, and scoring for the airport. So I'm more than happy. I brought that along to share with you today. And so you can see the specifics there. I also have an appointment to meet with them to actually go into a deeper dive here, and an appointment to sit with the CEO of one of the hospital systems here in Nashville, who's previous CEO, to go over their metrics. So, again, back to the commitment level. I mean, I think we're all here. We want to see this taken up, not just a notch, but several notches. And I think that will provide clarity for whoever.
Would that be something that could be shared with the committee? I know you're doing your one-on-one meetings, but just so we could all have the opportunity to talk to, and I'm not sure if HR is here, because I feel like in the last meeting we had asked for some sample evaluations of other CEOs for other Metro-led authorities, and so I am not sure if we've gotten that information or heard anything back, but I felt like that was kind of the starting point, was see what they're looking at or looking for.
We have HR here. Do you have any?
No, I don't have anything, but we can look into it, so I'll reach out to Diana.
Okay.
See if we can get that information for you.
Forgive me, Madam Chair, I'm still confused. I tend to be kind of linear. I would like for us to accomplish one thing first, and that's what else do we need to add to the current goals and objectives, because we said we weren't going to go into great detail to ask Dr. Webb to come up with something in 1 quarter that would be a challenge for him and a challenge for us to put together. Can we take care of that piece and then look at the deeper dive, which is, if we do a deeper dive now, in my mind, we're still forgetting about the easier part that we have to do more immediately. Does that make any sense?
No, that does make sense. And I think the way I was understanding what was being said is if we're able to look today or next week or the week after and see what the other metrics are, we can just see if there's a best practice or any alignment. I understand that time is of the essence. We don't want to be behind. So we can look at these 4 right now and say, what else do we want to know in growth? Outside of the new clinic, what are 2 other things we want to see? How are we going to weight, how is the scoring going to be applicable?
Yeah, Madam Chair, I'd be happy with that.
Okay.
To just kind of quickly get something on the table for Dr. Webb to understand what the next 3 months are about, which isn't going to be dramatically different than what's already there. And then we can take a longer look and a deeper dive into the more extensive review process.
Right. And I agree with that. I also feel like there is some value in seeing what everyone else is being evaluated under. And since we don't have that information or that guidance from HR at this point in time, we can move forward. And if everyone is comfortable with that, that's fine. But I can't. It almost feels like we are trying to recreate the wheel and make it great and get on schedule so that we will be in sync going forward, and that's what we want. But I think there are just some basic questions. How are other CEOs evaluated on growth? Is it a new building? Is it, what are those 3 things? So we can just go through and just start listing out other things we're interested in seeing, just for the interest to get it done now. Oh, yeah.
I'm sorry, I have a text from our chief HR officer who is not here on site. She's unable to be here, so she said to let you know that they used AHA, American Hospital Association, as the template in previous years.
Is that what you? That's what
it looks
sent us.
like.
Yeah, I mean it's the same format.
Yeah, very generically.
I mean, they used the title headings.
Yeah.
But they didn't do anything else. The AHA process is much more elaborate than what is on the table here.
Okay.
So that's kind of a weak issue. But I'd be happy to go through these now. I think among us, we have enough here for today.
Yeah.
So that we can get that piece done and then concentrate on the bigger issue.
Can I just pose a question, more of a thought rather than more declarative than interrogatory? But is there any concern about the fact we're going to create a standard or a performance metric within these that ultimately is getting ready to just be checked off? Like, I have some concerns about
It's
that.
getting what?
That's ultimately going to be just checked off. So we're going to say, here's what we're going to state as our performance objective, and we're going to create something at the end of the day. In 3 months, we're going to be, wow, we achieved that. Because
Well,
it's already been achieved.
But,
I mean,
but, but,
I guess
but
I'm just
Christie, is
trying to
that any
understand.
different than what we did at our last meeting?
I'm not saying I'm not saying it's not correct. I guess I just want to try to think through this. Besides just saying, hey, look, shocking. In 3 months, we're going to vote on this again. And Dr. Webb is 4 out of 5 or he's 5 out of 5. And you know what? We could determine that today, quite frankly, based on what we choose. And it just doesn't.
We're in a very
Feel
awkward position.
right.
And
Does
I
that make
agree
sense?
with you, but I don't know how we can not impose upon Dr. Webb more extensive goals when he's got 3 months. I mean, if I look at this, you know, I would love to see changes in some words. For instance, I think meet and maintain are incredibly weak notions to have on a goal. This is from what we just approved.
Oh, okay. Sorry, it's a
Okay,
minute.
these are the current goals. Goals and objectives. Maintain the Joint Commission accreditation. Well, that's a no-brainer.
Right.
That's
Right, so then let's
so.
go
And if he
through
met
each
them,
one.
then he didn't exceed them. Then he's not going to get the full amount that's allotted for that section.
Right. And I understand that. And what I'm saying is if we have to make this decision in 3 months and we want to make it fair, we want it to be informative, we want him to know what he's being evaluated on, we do have to work within the confines of what we got. I am not upset at bringing in different authorities, different CEO evaluations and working on something amazing for the next go round. But I think that we can still look at the AHA. We could, Christy may say under growth, the hospital has these, the airport authority has these 3 things. Do we think that would be beneficial here? This is the only place we can discuss this. And I would much rather have the conversation here than having Christy carry the burden of going and talking to CEOs, reporting back to us, and we don't have that opportunity to ask questions. So I want to dive deeper. I want more structure with it. But again, we've got an hour and a half today. What are we getting done today? We can set the meeting next week or the week after. Let's have clear guidelines on what we want from HR. If there's something we need from Meharry, if there's something we need from the hospital's council, give it to us in time to review before the next meeting. But we are going to continue to be held up because we can't talk outside of this. We don't have any other information. So what are we going to do in this next hour and a half? Let's tighten up these 4. If you don't like maintain, we can change that. I love to wordsmith. Like, I love to nerd out on that. So let's go, but at least let's know what the broad objectives are in the beginning so we can dive deep. All right. Let's go. Okay. Oh, I'm so sorry. So we did not approve our February 28th minutes. We came in ready to work, sorry. Can we get a motion for the approval of those minutes?
So moved.
Second.
And a second, all right, the committee has approved those. Do we want to start with growth? The current growth objective that we looked at and voted on was develop the new clinic in Bordeaux on Clarksville Highway.
Before we hit that objective, I just did want to make mention of the Littler letter that was asked by, I think by myself, to get legal clarification on Dr. Webb's potential interest on the bonus payment. And as received, it looks like that there would not be any interest paid on the delay of those funds. So I just wanted to, for the record and for our minutes, mention that letter, that legal opinion by Eric Stevens at Littler and Menderson. So.
Okay, perfect. Thank you for putting that on the record because that was a critical piece of last week's conversation. You got it? Okay, perfect. Perfect. Okay. Try it again. Growth. Do we like what we currently have? No. So what would we like to build on? Is the clinic in general, is the new clinic a good barometer examining the hospital's growth going forward? We know it's open. do we want to dive deeper in that? What is the committee thinking?
So
If we,
can I ask a question, Madam Chair?
yes.
So, to me, growth seems, of just looking at it as a clinic, seems very short-sighted. This is just my opinion. To say that growth, you're only looking at a clinic. Growth includes service lines, growth includes, if you're going to talk about a hospital, growth includes partnership, growth includes collaboration. So it's more than just saying, you got a clinic, yes or no. That's just my opinion.
So, Madam Chair,
Yes.
I just want to make sure we're in order, because normally we have public comments for meetings, but are we allowed to have question and comments in a committee meeting from outside committee members?
Well, that is what I was just talking to Ms. Lester about. I think that
Turn your mic on.
Oh, I'm so sorry. That is what I was just talking to Ms. Lester about. I think, again, in the interest of time, it would be beneficial for the committee to go through and just figure out what 3 bullet points we want underneath here. We can look at the AHA's guidelines and see what they've got, if they've got language we want to add. But I think we've got to get words on paper first before we start diving deep. And that is just me, that's just one opinion, but I think that we have to just make sure that we're focused on the task at hand, because at 4 o'clock, we all need to go.
But there's a specific question from the chair.
Oh, excuse me. Oh.
And Janet, you may be able to answer this. So we're in committee meeting, right? And so we are allowed to have outside entities participate in the conversation, is what I'm asking.
Probably a Derek question, actually.
And that's,
Okay.
I didn't know. That's what I was asking. I didn't know. I guess you're the attorney.
Yeah, I think that we're past the, I guess it's public comment at this point. So I think we probably, and I can't speak for Derek. Right? I forgot you were down here. Sorry. I don't want to speak for, Derek, and I don't think I can. But I think in the interest of just ensuring that we don't kind of go out of order, we shouldn't have.
That's why I wasn't sure. That's why I'm just going by my other experience.
Right, and I'm just going to ask again, I keep saying in the interest of time and efficiency for the committee, we have got to, the 4 of us have got to figure out what we want to put under here or schedule the next meeting. And again, it doesn't have to be super, whatever we can get to, but we've got to have something. And so I think there is an opportunity for public comment when that opportunity has passed and we have jumped into the goals. So let's just get to the goals, please.
Okay, so is it my understanding we're trying to pick, for purposes of the growth category, multiple metrics, for lack of a better term?
Correct.
In this category, where previously there has been one metric last year, which was develop the clinic.
Right.
Is that correct?
Correct.
So if we are, and from an airport standpoint, I've been on committee meetings, we definitely have had people interact, not just at the beginning, but I think it's been specific in context to either a request or something where we would help bring you into the conversation. So I think different than a committee member, but more of a ask about a specific topic or something very specific. But I will say I appreciate your comments, because
sure.
I think from a growth perspective, this was a very linear one topic, your one trick pony, you made it or you didn't. And I think we need to make sure that we are looking at multiple areas of growth, whether that be a facilities build, whether it's growth of staff, whether it's growth of presence in the community, and those partnerships. So I do believe that we can achieve multiple aspects within the growth category. So maybe those are some topics, whether it be physical sites, clinical employee growth, if that's what we deem important, community outreach and presence growth. So there's just some to come to mind.
Yeah.
And maybe growth of revenues too, and whether that's a financial piece specifically, or we cover that, financial piece, but some aspect of moving the revenues forward too.
I agree 50,000 foot with that, but I think we're threading the needle here to not get into too much detail before, on this particular piece, get into great detail on the future piece. But it seems to me, for instance, without adding too much to this, since the facility has opened, getting some numbers on participation, on the revenue, and making some determination as to whether that meets or exceeds expectations, that I don't know at this stage, but it would be, I think, helpful to find out what the projections were and where are we today. Does that begin to make sense?
It does. I also want to state that one of the things I also want to be mindful of with regard to a CEO who has a contract that will be expiring at some point. As we are looking at these metrics and passing them not only as a committee but a board, I want to be mindful that the conversation as we seemingly the late and like just kind of more general way vagueness that we're passing these evaluations through, that is a couple years of somebody's contract. And so I just want to be very crystal clear from my perspective that we're not saying because a committee or process did not fully expand to where it probably could have and should have in the past, that we're not stating that, let's say 2 out of 4 years of somebody's contract or 3 out of 4 years of somebody's contract, because these things weren't done correctly or done at the highest level that they probably could have been, that means everybody gets an A+. I guess that's what I'm trying to say. I think that if we're evaluating these, I want to be very careful that we are putting this, stating this in a way that allows for us to move forward, but it doesn't specifically state that someone gets an A+, if that's clear.
And has implications at the end of a contract.
That's correct.
Regarding negotiations
That's correct.
for a new contract.
That's correct. I think we need to be very careful about setting a precedence that 4.5 out of 5 or 5 out of 5 equals A+ at the end of the time. I want us to be able to evaluate correctly going forward, but I do want to make sure that that's noted. Let's evaluate people accurately and fairly and give people stretch goals. So.
I'm just feeling like a broken record here. I don't know what else to do. I understand what you're saying. I'm saying under growth, we could say, is the new clinic open with patients, with doctors, fully staffed? That could be one point. How are we engaging in the community that is visiting the clinic and the hospital? Is Dr. Webb engaging with the community? Is the staff? I think those are things that he would be able to provide to us. We could see on social media, learn what they're looking to do in the future, but I think those are tangible things that we can see in the past and through these next 3 months, so you're not giving an impossibly high task. So I think we could definitely do that. Is the revenue of the hospital growing?
And
we
those
can look
numbers,
at all of those things.
There were projections for all of those things. And we should look at what those projections were a year ago or whenever they were articulated. Yeah. And then we can see, well, where does it stand up today?
Right.
And part of those can be part of the, pull from, I know we had a high focus on marketing, but some of those were, whether it be customer service or growth in population or growth in our average, I don't know what it's called. I'm not on social media that much, but likes or, our average number of stars. Are we growing that way? So yeah. I don't know all the specifics. But I think those are all ways that we could even lean into our marketing previous year's work to create some metrics too.
Right.
I mean, if we put 4 of these things in the growth that we just referenced, to me, that would be sufficient because we're still looking at just 3 months.
Correct.
And the past 9 months and
Correct.
not looking at major changes before the end of June, but to look at what is versus what the projections were.
Okay. And those numbers would be with HR, those projected.
Well,
CFO, okay.
Yeah, we were given a performer on the clinic. So we need to look at the performer for Bordeaux and compare it to where we think we are now, or at the end of June. So we can pull the performer.
Okay. So under growth, I am hearing our community engagement, our social engagement. Have we hit the projected numbers that we believe the CFO would have? And then looking at the Bordeaux pro forma to see if there's staff hired. Is there, like, what else is in there? So those are the 4 things we would want under there. Is there something extra?
I'm not familiar since it came on, mid-year, but were there other clinics or other areas of physical growth, whether it be employees or locations or
Employee retention, attrition,
those
yeah,
things?
all of those
I think longer term, I don't know if we do an employee survey, but that should be done. With satisfaction.
Should the Charlotte facility be included
Yeah,
in
that's
that?
what other facilities, if we're going to say one of the categories is physical presence in terms of growth, what have we built? What clinics have come online? What staff have we hired? Those are natural things to me that come, to mind.
Okay. I'm fine with that. Ms. Lester, did you get? So it almost sounds like we have subcategories and then subcategories under that. You'd have the growth. What about the clinics? And then under that, looking at Charlotte, Bordeaux, are they fully staffed? Are there patients? Then you look at community engagement. How are we engaging the communities around our facilities? This hospital, Charlotte, Bordeaux. Then we look at social media engagement. How is that? Are there no likes? Is there no interest, no traction? Just to see how we are that's one level of marketing ourselves. What kind of, and then under that, you could still have what other marketing information are they giving out?
Yeah, and tied in, probably put it under financial, are the revenue goals being, from the pro forma being met.
Okay. Anything else we're thinking under growth that we'd want to be a topic or a subtopic?
I think that's a good starting point for this year.
Okay.
Without being overwhelming and setting us up for the next stage.
Okay. I'm in agreement 100%. Okay. Okay. So financial. I'm sorry. Go ahead.
Actually, I was reading what we have here under financial, and I like these marks.
The AHA doc. Okay. Yes, ensures adequate financial controls are in place to protect the health, provide accurate and complete financial reports, enhance revenue, and control costs. I think those are 4 financial metrics.
I think the metrics are fine as written, but we need to tie them to a specific goal. So I think if I were to read, how do you grade yourself on enhanced revenue and controls costs to ensure achievement of planned operating margin? How are we going to measure that? And what differentiates 1 versus 4? So I think we need to be clear about, anything that feels vague, we need to tie to a metric. Okay. And I would take out audit. There's no reason that we should have an audit that's this late comparative to this last goal, which was have a successful audit with no ongoing concern, when we still don't have a true finalized audit. I mean, that makes no sense. And so let's make sure that that's not part of the conversation going forward.
So no audit under financial given the timeline.
Or or give it,
Hold on, explain
or
that to me.
based on the prior year, because
Oh, okay.
right now,
Okay.
the audit
Wouldn't be ready.
wouldn't even be ready.
I got you. So prior year.
A prior year, if we did, as one of the metrics of, let's say, these 3 bullet points, a successful audit with no ongoing concerns, that would be for fiscal year end 2023.
But, even where it says goals and objectives, meet financial goals, shouldn't that be meet and exceed financial goals?
Yes. And then there are metrics that can back that up. So yes, meet and exceed. Are we interested in anything that is under the financial management or on this doc that Board Chair Stevenson referenced? Or is there anything that jumps out to you that you would just want to know as a committee member about the finance?
I think that it would, and again, this isn't necessarily, I'm just kind of brainstorming here. Doesn't necessarily have to be in this year's goals, but I do think some reference to, obviously, our tie with the city and the money that are ultimately, whether that's increasing or decreasing, remaining flat as to what the city is augmenting into the budget. So I think that that's an important metric to measure. I think it's important for us as a taxpayer to be able to track, and I guess.
You're suggesting that be a part of the CEO's evaluation?
I think it needs to be measured, and it needs to be.
The city's contribution?
Yeah, because the more we have to take, and I'm just brainstorming here, Frank. The more we have to take from the city, right? To me, is not a good thing, right? I mean, I wouldn't think so. I don't know how to tie this.
I
in the right
almost
way.
change that because
change
I would think of it. I would think of it more this way. We have a partnership with the city, and the city provides funding that is
Absolutely.
critical to us. How is the CEO engaging with the mayor and council? Are they having consistent meetings? Do they know our financial status, where we are? Are we having conversations? Did we get fully funded in council's budget when that? And we wouldn't know that by the time we would.
Yeah, I don't think we know
so
that
I
yet.
think it's looking at those things. Are we getting letters from Metro Finance saying that we are in? Just kind of, I understand where you're going as far as
just
looking
trying
at
to
that
make sure
relationship.
that we're in partnership.
Yeah.
And
No, I see where you're going.
Yeah.
I just want to clarify, because again, this is live. The entire city has the opportunity to watch us in these spaces. I just want to make sure that we kind of say our language in terms of what we mean. So we're not taking money from the city. It's not we're not saying we're taking it from the city. And the more we take, the better it is for the city. What it is the city supplementing to make sure that we can care for the least in our populations who cannot afford. And sometimes that's the city's obligation from its charter. That's what the city said it would do in its charter. And so it's not that the hospital is taking money from the city. It is the expectation from the city that the city is supplementing the cost. And so that cost change. And sometimes there are politics in that, but I would be very cautious about evaluating the CEO based on how much the city gives to the hospital. Those are two separate things, and I don't want us to suggest that it's tied together. I agree with you, Chair, that the relationships that it's important. The mayor's office, the city grounds, those pieces are really, really key.
Yeah, I would agree with that. That some wording that suggests are we experiencing and these are not the right words, but the best relationship for the advantage of the city and the hospital to the finest extent?
No, I would definitely agree with that, because we know that the board goes before council and provides a report and update on what's going on. And so I think those are the things we're looking at. Is the CEO in these conversations explaining current needs, future needs, where we may be falling behind? I don't think it's in a negative way, but just is everyone being fiscally clear on what's going on? But not saying, oh, if council has other budget needs that they're prioritized. I don't I don't know if I
No,
agree
but
with that, but I
I
understand.
think the sense of this is that it demands a full understanding for the board of the entirety of the relationship with the city,
Right.
so that we are in the best possible position to explain our needs
Mm-hmm.
and to be able to anticipate that the relationship is good enough that there will be recognition of what those needs are.
And I think, Christy, to your point, I think really what you were getting at is the accountability of the
Yeah.
dollars we
Fiscal
get from,
responsibility,
that we
that's
get-
what I was
yeah,
going
that
to
we
say.
get from the
Fiscal
city.
responsibility,
That's right.
to
Yeah.
show that, if there is a need and we're asking for more, then this is the output of that. But also, here's what we have done with the money that has been allocated to us. And I think that's an important piece to show, because I think there is some, there's some thought.
Yeah, I think you're absolutely right, onto something.
Right.
But it also, in the longer version that we hopefully will do, it has to do with more than just that kind of, just the financial piece. It's about our standing in the community and how we just approved a big marketing and political contract, how that is managed and how successful that is all comes under this, because it is about the responsibility outside this building.
So how do you want to handle the specific pieces on, are you stating that you want to add these 3 categories? And then what are we tying to those categories under financial management?
So under financial management, we said meet and exceed financial goals, which we could document that through,
Because that's what was on last year. It says meet financial
just
goals.
meet. Did you meet them, but are we exceeding them?
Okay,
Are
what-
we falling behind?
So what is our financial goal, I guess? I was confused last year when we say meet financial goals, and the criteria was only an audit. So what are we saying as our criteria this year? I'm just trying to understand the difference.
Yeah, I think for the most part, the financial goal is just the budget. How close were we,
Okay.
I mean, that's our map.
Certainly at this stage.
Yeah.
So did we meet and exceed financial goals as dictated by the budget? Did we fall short? Did we exceed? What does that look like? If we exceeded, was it something beyond everyone's control or knowledge, or what? Then I think you would dive deep in those conversations as you're ranking them.
And the good news there, Christy, is as chair of the finance committee, you'll have a real good beat on that.
Yes.
Thanks, Greg.
And then we were saying, look at the prior year's audit success. I have that as my second one. Then I just wrote city relationship with the city, and wasn't sure how we wanted to flesh that out. Because it's really, is the city aware of our financial needs? Do they understand? So I'm not sure quite how to phrase that, but just. Kind of where do we fall within the budget, and are we able to, whatever we put forth as the budget for that year, did we receive that? Was it more? Is that two in the? Okay.
This one, I think it's more of the kind of 50,000 foot.
Okay.
How would we define the relationship between this hospital and city government?
Okay.
And we're putting that under financial.
That's a great question.
Well, it could go under customer service. I think the reason it's triggering finance for all of us is because there is funding that comes from the city, that the city will pay, but it's also a relationship aspect to that as well. And I feel like at the board meetings we hear that we're meeting with the mayor, and so I don't know if going forward, if we would dive deep on that, but just what is that relationship producing?
Well, we know the answer to it because we got a substantial amount in this last budget from the city. So we know what the answer is, but I think it's a good starting point to begin to have it in the goals.
And also, I think in the work that's being done for purposes of debt collection as well as payment out to third-party entities is something that definitely can be measured as well, that could be used as metrics. We see a need, we're evaluating that need, and like, let's set a metric and let's try to achieve that.
Okay, are we comfortable with those four that we have listed under financial?
I think for now I am.
Okay. Okay, so it's the prior year audit success. Did we meet and exceed our budgetary goals? Is there accountability of the dollars as we engage with the city? And then we want to look at debt collection and payments. Are there a lot of outstanding payments that can be, am I taking words out of your mouth or not?
No.
Okay, I don't want to misrepresent what you're saying. Just what are the outstanding payments and how are we remedying that? How are we working with those third parties? And I imagine there could probably be more teeth in that, but just generally is that, okay. And those were the four that I
Again,
had.
it's movement in the right direction.
Of course.
Given where we are for this year.
Yeah, yes. If you've got 20 outstanding bills and you drop to 15, there is progress in that and you should be rewarded for it. But,
Right, and
getting
a timely payment. So if we're
Yeah.
doing 120-day payment versus 90-day, and we're moving the right direction towards a 30-day pay,
Yes.
I think that's a good thing. Again, it pushes our reputation forward. We're seen as more financially stable, and people, quite frankly, want to do business with us.
Exactly.
And will be the basis of more detailed assessment for the next evaluation.
Exactly. Okay, so the third one is quality, and this is maintaining a joint commission accreditation and certification. I think there are a lot more things we could include under quality. We have some examples of that. Just looking again at the AHA, they have quality of care and service with 4 bullet points. Do we deliver clinical care that demonstrates continuous quality improvement, progress toward meeting the standards? Are we delivering customer service that is rated high through patient satisfaction? And ensuring that the organization takes all measures necessary to ensure the safety of patients. So do we want to tie in, help me remember the name, is there the survey that is it Leapfrog? Yeah. The Leapfrog survey,
HCAPS as well.
HCAP,
That's the one where the patients.
the patient, yes.
That would be more customer service.
Yeah.
But so for instance, under quality, goals and objectives, maintain joint commission accreditation. To me, that's meets minimal expectations.
Yeah.
That's a 1, that's not a 4 or a 5. You better get that.
Yeah. Quality, do we maintain all accreditations
Yeah.
and certifications in
Right.
order to operate? Yes, no.
And yes, it should be yes in every case.
Yes.
And if it's not, we've got real serious problems. That's a minimum as far as I'm concerned.
Okay.
So remind me the difference between HCAPS and Leapfrog?
Which one is the customer evaluation?
The customer is the HCAPS. That's the one their patients would evaluate the hospital, the doctor, the cleanliness, would
Got
you
it.
recommend, all of that.
And the other one is,
Outside organization that would, you can help me on that one. It's outside organization that looks at certain measurements and then gives us a scoring like A, B, C, D.
Yes.
Scoring.
as a comparison to other hospitals?
Some hospitals, yes.
Okay. Thank you.
Okay.
And then there's the other report that is given, I'm forgetting the name of the report, you may know, Frank. It's talks about the specific percentage of, I guess, success or achievements within all the different areas of the hospital, whether it be ambulatory, whether it be, I know with maternity ward care and things like that. What is the name of that? Do you know what I'm talking about? It gives us sepsis report. It gives us the infant mortality, I think, report. It's in our.
It's in every.
It's in.
The quality report?
Is it quality report? Is that what it's called?
That would fit.
That would fit in quality.
Yeah.
Sorry, I didn't remember. We had a lot of reports.
No, you're right, but it would fit, I mean,
Right,
quality is
yeah,
quality. you know?
yeah.
Right. If we're calling quality, or we're looking at infant mortality or sepsis or ambulatory care or whatever it is, I think those are important.
No, I think you're on to something. So we get a quality report to some degree at every board meeting. But I think as a part of this evaluation, we could ask for a quality report of the year, of the fiscal year, that gives us a full review for us to take into account as we measure this.
And so I had all 4 of the evaluations included under quality, just because I think patient satisfaction, third-party hospital review, and then our evaluation of quality care would be critical. 3, excuse me, not 4. 3 metrics.
So you put patient satisfaction there and not in customer service?
Well, it sounded like we wanted all of that, because I feel like that would speak to the quality of care, the patient satisfaction, but if the committee wants to keep that under customer service, that is fine as well. If we're just doing leapfrog and the quality care for quality, just that evaluation.
Just keep going. Let's see if there's other metrics in customer service that might be a better fit, and we can always move it.
Okay. So we have the external reporting and then the accreditation and certification. Is there anything else that we think would be important under quality?
Again, I think for now.
Okay. I just wanted to make sure everybody was.
It's good.
Okay.
I think for now.
All right. Let's go to customer service. Currently, we've got maintained the HCAPS, which is the patient evaluation, and the measurement criteria is just maintain patient satisfaction scores.
Shouldn't it be grow?
Excuse me?
Grow instead of maintain.
Yeah, we just put that in quality. So
Yeah, we just put it in quality.
Moved it down
Right,
here.
right.
But I agree with you, grow. instead of
Any
maintain.
place that says maintain,
It's
We
average.
don't want to maintain, right?
You want to grow. The other thing I think would be helpful, and again, I don't know that we do this, you may be able to answer. Do we do an employee satisfaction survey? Yes. Annually, okay. So to me, that is part of maybe, why it's not customer service, it's tied to customers, how we service our customers. I don't know, maybe,
Staff is customers.
yeah, I think so. I feel like it is, so.
Okay.
We want our employees and associates to be happy and feel empowered and to be part of the organization and to lean in. So we need to know what's going on.
We also do it with physicians.
And physician survey. Okay. So there's
Okay.
employee and physician survey, 2 separate things.
Okay.
Okay.
Okay. Anything else for customer service that you want to see for now?
What about, I'm just trying to brainstorm on who a customer would be maybe, and that'll help us kind of decide this. It's our doctors, it's our associates, it's our clients who come in and out of the door. Our customers are arguably, vendors, and people that we have relationships with, whether it be somebody coming to work on the HVAC system, but also, and I'm not saying we're trying to make everybody happy who does business here, but for a standpoint of other people like Meharry and Vanderbilt and all these other entities who are part of the community as customers too, right?
Well, I think we can't limit it to just 2 entities, right? There's
Yeah. Well, I mean, I'm just brainstorming who might be.
No, I think, well, I was going to just say that,
partners.
I
These are
think
partners in the community.
as we stretch forth in our next go round, that we've got to look at our partner relationships as a part of this. I think trying to slide it into customer service would probably not be good. It's almost like expanding that a little too far. I think it's its own category. I think our partnerships is its own separate category that we should evaluate at some point. Probably not in this one, but I definitely think we need to look at that.
Something definitely for,
Yeah.
again, not this one, but yeah,
Yep.
definitely. Okay. Are we okay with those three for customer service, the HCAPS, employee satisfaction survey, and the physician survey? Okay.
So we're moving HCAPS down, it sounds like,
H-
and leaving
CAPS was our-
leapfrog, quality reports, and joint commission, and the other one, and
In
quality.
quality, yes,
Okay.
yes.
Okay.
Okay. I think we've got the ones for now that we can flesh out, but we at least know the topics. Yes.
No, please finish.
Okay. And then just wondering how we want to flesh these out or get these written so we can, or is that what we want to do in these next 40? So we'll be able to leave with a complete list or what?
Before
what are we
that,
thinking?
can
Oh,
I
yes, sir.
make a suggestion?
Okay, yes, sir, of course.
I really like on what AHA's list, there is a category of board relations and communications. And I like the 3 bullet points that are here listed. It's on the, I believe, the second page towards the bottom. And I would just put that on the table for some discussion.
Yeah.
What was that last category? Was it?
Customer service was the last one that had the HCAPS, employee satisfaction, and physician survey.
I'm just wondering if you can broaden that because it's partly kind of communications and, or are you thinking a separate topic?
I'm thinking of it as it relates to the board.
Oh, I know you were thinking that. I'm just thinking,
It sounded like you were saying make that so when we look forward for that next evaluation, we would add the partnerships heading and then add the board relations and communications to that? Or did you want to tie that into customers? Service
I
or
don't care
quality
where
or
it's
growth?
brought in.
But you want it in for
I
this?
want my suggestion would
Yeah.
be for these 3 bullet points, whether it's a separate category or not. And frankly, I think the relationship with the board is a separate category and is a very important one, as the board is responsible for policy. And I think communication with the board is a very critical part of all of this. And that will only enhance the opportunity for Dr. Webb to meet and exceed the goals that we set for him.
Can you say, broaden the category instead of just saying customer service? Maybe we say customer service.
I would like
and
to see it
communications or
being-
something like that?
being-
I think you can do 5. We got 4. We're going to add one more.
That's right.
Is it-
Okay.
Just taking what it has here
Yeah, just
and just popping it in as the 5th category.
Okay.
we just add.
Yeah, we have 5%, so that, okay.
But that's the prerogative
The
of this
math
committee.
simple. Okay. I think that is fine. I think that's great to add to this list we are working on for right now, and then we can add partnerships and others later for the next one. Okay. Okay.
So when we get to the evaluation component, there are going to be some things we're going to need as we're doing this evaluation. And you heard some of that. But I mean, the HCAP, the leapfrog, quality report, all of those things are going to be things we're going to need for our evaluation component of these 5 things. And so there's several more. I didn't name all of them, but there's several more in there. And then also, we typically have in years past, we can do the same thing. Once we flesh that all out and write it all up, we would typically give the CEO self-eval to also respond to those each one of those subcategories under our heading. So I hope maybe that's where we can move forward.
Yes, no, I think we definitely would want a self-evaluation just to be able to look at that as well as make sure that we have all the right documents from finance, HR, and those representatives here to explain some of those details. So I don't know if we just need to send a letter or email, just these are the things we need based on this evaluation. Okay.
We'll work together.
Okay.
Would it be possible to, because we're hypothesizing and we're collaborating, would it be possible to send a draft out to us with the specific metrics tied to this so we can review it? I think that would be, I'm a visual learner.
Sure.
So I think seeing that and being able to say, okay, oh, well, actually I'd move this here, or let's nail down, or this one, this specific component doesn't have a metric tied. I think that would be helpful for me visually.
Would be helpful for me as well. Would it be inappropriate, Madam Chair, for experts in the field, meaning HR, to actually help do the wordsmithing? I'm not an HR expert. I think it would be helpful for those who know how to do these things to maybe help sort out what we've tried to put together today.
If the committee would like HR to help with the wordsmithing, then we could move forward with that. Maybe HR and legal, I'm not sure who would be the best. We could just have HR review it if you're okay, if the committee's okay with that. Or help come up with the wordsmithing.
HR first.
Yeah.
Just make sure everything's kosher.
Yeah.
Yeah, I think having though the right framework and structure that, I don't know, you know, how we would do this, if that's something you want to put together first.
Yeah.
And then disseminate and then let us collaborate back to you and then send to the appropriate people. But I think we want to make sure that it's, we're not overly burdening you to come up with the objectives for Dr. Webb. I don't think I think it's inappropriate. I think we need to get it maybe to make sure that the things we're asking for ultimately are in line with what we can provide and is accessible to us. And so the metrics are actually things that we have access to. Sure. I think that's part of it, not just wordsmithing, you know. So I think wordsmithing, yes, and legal, but at the end of the day, we need to provide the framework and the very specific metrics.
Correct. And I think that after this meeting, we can go and fill in the topic, put in the goals and objectives, measurement criteria, a time frame. We can review that as a committee. Is there anything you want to add, delete, need more clarification on? And then once we've agreed on that, we can have HR review. And there may be topics or things that you want to include that we didn't think about. So there's an opportunity to see if that needs to be included.
So what's the process then to accomplish that? I mean, does everybody try to do this on their own and then send it to you to put it together? I'm not clear.
Well, what my understanding is that I would work with Ms. Lester, put it in this form.
Okay.
And so Ms. Lester would send the committee this draft and say, please review. And you'd go through the 5 categories. Oh, I don't like the way you phrase that. Here's a suggestion. And we're able to compile that, get a draft completed, and then send to HR. So that could be. Do you have any suggestions?
I'm spent.
Okay.
I'm ready to move on.
Okay, no, I understand.
And let people who are better versed at this than me put this together. And because I think we've captured what we're talking about here today.
Right.
And I think it's possible to have HR look at it. And if it doesn't capture what we've said, then it would be easy then to reimagine it rather than starting from scratch with words that don't fit in the HR kind of language.
Right. Okay.
But I go with whatever y'all decide. But I would not expect too many words coming from me in the interim.
Well, and
I would make a comment, but I won't.
Not on the record.
I like this partnership.
I think we just send it
between
out.
the two of you
Yeah.
to create, Janet, Michelle, a draft to get it back to us to make sure that what you heard actually is encapsulated in the document. And then from an HR perspective to see if there's anything specific that we might need to change.
Yeah.
But I do think that the majority of the work and the collaborative effort probably should be here because you're both hearing what we've, I guess, our feedback.
And then you can look at it, and if you're like, this is fine, I'm ready for HR's HR's wording, then we can get that back from them and, but just to get that, I think it's the transparency we talked about in the last meeting and the open communication as best we can, given the confines. I mean, we could get this draft. I mean, I could work on it and send it to you and get that to you in the next day or two. When do you want this final? Do we want
Well, I think
to have it final next week? Yeah.
So that we don't leave Dr. Webb hanging for another month.
No. I feel like in the next day or two, I can get this to you. We can get it to HR by the end of the week. And you can just review and tell me if there's something I missed in the minutes, and then we can just get that to HR by the end of the week. Is there a time frame? Are we meeting again to discuss these, or once we have HR's wordsmithing, we are fine moving forward for this one, and then we schedule another meeting to work on the next one, the next year?
Do we have to review this together, or can it be reviewed individually via email?
I think individually, and then you could just respond to Ms. Lester with your comments, and she could, she could compile them and say, oh, there are big red flags with this one. You all may need to discuss, or everyone was in alignment. It's going to HR.
The question I have, is there any kind of board action that needs to be taken out of our group? One, I would assume there would be, right?
The recommendations. Yeah.
Right, to the board.
Yes.
And then the second thing would be, I'm not knowledgeable about this, but I don't think we can do that via email. So we would have to schedule another meeting to ultimately
To
get
vote on
this
the
through.
recommendations.
Yeah, no,
Yes.
there's a lot more that has to happen. So
Right.
we have to we have to agree that this will be our template, and we can do that part by email. And once we agree that this is kind of like once we're through wordsmithing, HR, and all of that, then we've got to come back together and then do the evaluation based on the template. So that's probably May or June or something.
July, because it goes through the end of July.
Yeah. So
But approval of our setting of goals for this fiscal year,
The recommendations, they need to go to the full board.
full
These
board,
are the,
and
these are
that
the
will not
committee's
be
recommendations.
until April 27th or 28th.
Yeah.
So we need to have this completed draft finished, and then we need to all get back together to in-person approve a motion that goes to the board for full recommendation that then gets approved in April. So we need another meeting between now and April is my point.
Yeah.
Correct?
Yes.
After that, we go ahead and set a meeting come July or the 1st of August to start the process of the next evaluative techniques. Is that right? I just want to make sure we all are on the same timeline, that we agree with that or not.
No, you're absolutely right. It'll be a one agenda item. I wish we can do it maybe right before the board meeting, because we will all have looked at these things and know what they are. So it's not, we don't need to come here a different day to do that. We do have to have an official meeting. It has to be posted. So maybe if we do a 3:30 before, what time is finance?
3.
Finance is at 3.
Yeah, right.
Yeah. So we can look at a time in April, but ideally on the day that we do our committee meeting, if we could meet before that, that'd be just great.
The only problem is that we need to
Publish it.
publish this 7 days prior to
I
the
got you.
board
We're
meeting.
going to have to come together,
So
yeah.
That's what I thought.
actually, so if it has to go public on the 18th, if we could meet, say, by the 16th, if you had any last minute corrections, changes, heartburn or whatever, then we can get that fixed before the 18th when we have to
Posted.
post it for that meeting. So if you could meet by April 16th, that would be best.
Since it's a one agenda item, is it possible to meet in advance of the next board meeting? I know the finance committee meets, but it's like a 5-minute item.
Well, that's what we were just
That's what we were
talking about.
saying. You have to post it 7 days before that, so we can't do it then.
The board has to have a few days to, the 7
I'm
days to
talking
look
about
at
for
it
the
before they take a
For
vote.
this committee to get together, why couldn't they just do it at next week's meeting?
Because don't we have to approve it before?
I'm not saying to put it before the board next, I'm just saying so you don't have to come back for one.
That's if the work is done by then.
Right.
And that's only giving you all and HR a week. Not going to happen.
It will still not go to the full board until April anyway, either way.
I was just trying to come up with a way so that they didn't have to come back for 5 minutes.
Right.
Well, if it's
That's
done
up to you.
by that time, could be.
I'm gonna believe that I will do my part with Miss Lester, and we will get it to our friends in HR, and I believe they are reading the room as well,
So-
as far as timing, and so.
So you
I want
think
to believe.
we can
Yes.
come back next week and have this committee meeting?
Yeah, I actually think we've done the hard part on
Right.
this.
Yeah.
I
Yeah.
think we've done the hard part. I think it's going to be, I think once they start putting their magic on it and cleaning it up, I think that can be ready by next week. Yeah.
I would agree. I would think
Could
so.
everyone be here by 2 or 2:30?
Huh?
Could everyone be here by 2 or 2:30 on Thursday then?
2:45?
Well, there's a finance committee between 3 and 4, and we have,
Do we have a lot on that agenda?
well, you and I have to be in the finance committee. I can't be two places.
Yeah, but I'm saying, let's say we stopped finance committee at 3:45, and we started this one at 3:45.
That's perfect.
That's why I was saying, how much do we have on the agenda? How much do we have to approve?
Can you back finance
Well,
up?
you,
It's too late to back finance up because it's already published.
yes, it's too
Okay.
late. It's too late to change
The
that.
only thing we can hope to do is,
Stop at 3:45.
can we even repost and say we're gonna do 3 to 3:45? We can't do it at this time.
Yes, actually, we could. We're within the 7-day.
Do we have a lot to approve on finance?
Well, that's in the big board. They're gonna have the auditors there. So that's.
Normally what takes a lot of time in finance if you got a lot of contracts. Do you got a lot of contracts? So I think we can do it at 3:45. Do we have to post this meeting? You got 7
We
days,
have
though.
to-
But you got 7 days?
Yes.
Okay.
As long as they do it by Thursday.
I think we should go
By
with that.
tomorrow. Metro, can you do 3 in a row? Back to back? Okay.
He's like, okay.
I like the teamwork. Okay, so next week, we'll have 10 minutes before the board meeting. Okay. What time do we need to be in here? I was gonna say.
You had 3 meetings in one day.
Oh, my goodness. It's gonna,
Everybody just needs to be here probably at 3:30, 3:40, and as soon as we finish, it would be ready to go at 3:45 on the posting. Because we got to have everybody on time or else we're not going to have a quorum. So let's make sure we're here on time, ready to go. I'll be here because I'll be here for finance. So.
yes, we will be here. We will be here and we will work with I will work with Miss Lester. We will get minutes done. We got this. We got this. We got an ambitious committee, so we
Okay.
can
Thank you,
knock
Ms.
this
Lester.
out.
Thank you very
And
much.
can you go ahead and work on some dates that would be appropriate for us to look at for July? I just want to get ahead of this. Oh, we already have it on. Oh, we're already ready to go then.
We're ready.
Good. My bad.
We did that last time.
What was the date?
I was going to ask, not quite, if there was anything else. But we'll get this date first.
to be 50, and I'm going with my kids, and we're going on vacation, and my birthday's the 20th, and so, guys, I'm out. Probably not going to be on the 16th, and I really want to be here, so I'm just saying, do y'all mind if we?
Okay, so do you want to move it up earlier a week or after?
Either way.
So the week
but
of the
I was thinking,
22nd?
Yeah, maybe something like afterwards, like the.
The week of the 22nd has our full board and our finance committee and so forth, so I was trying to, just for sanity, avoid.
Yeah, trying to. Yeah, this is July. Sorry.
Can we do
This will
20th?
Yeah.
This will be our final one to approve, right?
This will start the new round.
Evaluation for fiscal year 24.
It's fine. Keep it on the 16th. I'll plan afterwards. Don't make it hard on everybody.
Okay. We can have a birthday party.
It's okay. It's all good.
Just let us know where you're going.
Yeah.
I know.
Maybe like, peace out. I'm leaving like right after this.
I love it.
Get
Okay.
on a flight.
All right. Do we have a motion to adjourn?
So moved.
Second.
All right. Committee is adjourned. Thank y'all for being here and participating.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.